All right, welcome to our Spring Health Professions Week Tuesday video. We've got a very special guest with us today. We're going to follow our normal format today as we explore careers in anesthesiologist assistant. So I have a short video for you, and then we'll do some audience questions. I've got a couple of questions for Shane Angus, who's joining us today. And so we're going to explore this a little bit more in detail today. So let's get started, and I'm going to roll the video first.
Certified Anesthesiologist Assistants, or AAs, are highly skilled health professionals that work with licensed anesthesiologists as part of an anesthesia care team model. Extensive training in all aspects of the delivery and maintenance of anesthesia and advanced practice monitoring techniques ensures that certified AAs implement and provide the best care for our patients.
I have worked with many certified AAs, some with years of experience, others fresh out of training. Either way, they are well prepared for all aspects of perioperative patient care. They perform preoperative patient consults, review labs, EKGs, chest x-rays, MRIs, and a myriad of other patient tests. They place intravenous catheters, intra-arterial catheters, and pain control blocks that prepare a patient for surgery. They are trained in advanced airway and life-supportive techniques that save lives. I can rely on them as a part of the anesthesia care team to fully care for each and every patient.
We work together, sharing our knowledge and skills to provide both safe and excellent care for our patients.
Working with certified AAs, I can run up to 4 operating rooms at once, increasing the quality of care and providing greater access to the operating room and various patient care settings.
All AA education programs award a master's degree and are affiliated with an accredited medical school. Certified AAs work only within this model and under the medical direction of a physician anesthesiologist.
Before practicing, an AA passes a national certification exam developed in conjunction with the National Board of Medical Examiners, the same entity which develops the board exam for anesthesiologists. AAs must recertify every 6 years.
Each member of the anesthesia care team collectively conducts a patient interview prior to surgery, formulating the best anesthetic plan. The cooperative model is the future of quality health care. Certified AAs practice in numerous surgical settings, from preoperative clinics to ambulatory surgery centers to large hospitals. AAs provide care to patients across the spectrum of surgical specialties. We brought certified AAs into our practice a few years ago. By doing that, we were able to not only provide an increased level of patient safety, but also to increase patient access to the operating room. My facility is now able to provide more surgeries to patients sooner. The patients I see are also much more satisfied and have been taken care of quickly, safely, as well as cost effectively.
At the American Academy of Anesthesiologist Assistants, we encourage more and more doctors to hire certified AAs. Our goal is 100% licensure across the country. AA licensure is gaining wide acceptance, and every year we see more states including AAs as physician extenders to meet growing demands for anesthesia providers. The American Academy of Anesthesiologist Assistants encourages excellence in patient care through education, advocacy, and promotion of the anesthesia care team by advancement of the AA profession. By training pre-med students as advanced anesthesia physician extenders, we eliminate pulling from already stretched critical care nursing supply.
Anesthesiologists have always been and will continue to be leaders in innovation when it comes to patient safety. Certified AAs are proud to be part of a solution.
Certified Anesthesiologist Assistants. We love our job, and we highly value our role and responsibility in being able to take care of patients. They deserve the very best. The American Academy of Anesthesiologist Assistants. Effective, expert, team care.
All right, and so I do want to thank our partners at the Association of Anesthesiologist Assistants Education Programs for helping us to get this video for the Health Professions Week Certified Anesthesiologist Assistant playlist. So we've talked about how you can find these videos, and there are certainly more to watch today as you are exploring. I am going to turn my screen off so that we can focus on and welcome Shane Angus with us, again, from our partners at the Association of Anesthesiologist Assistant Education Programs. I've had a lot of coffee today so that I could get through that today. Shane, you are a certified anesthesiologist assistant, and you work at Case Western Reserve as one of the many hats you wear. So welcome. It's nice to have you here today. Tell us a little bit about being an anesthesiologist assistant, and how did you choose this career path?
So thank you very much for having me. I'm really pleased to be here to talk with you and talk with everyone else, and look forward to the questions. So yes, I am a practicing certified anesthesiologist assistant, and I'll sort of do it in a backwards answer, if that's okay. So I came across this profession accidentally, in that I was talked out of medical school by some residents and medical students who I had gotten to know during my undergraduate training in the Bay Area in California. And thankfully, I listened to what they said and took their heedance. And so I went back to my advisor, and she was really busy, and I was a bit anxious. And so she said, just go look through the binders. And I looked through the binders, and I kid you not, a little 3x5 card fell out, and it said anesthesiologist assistants. And my head just kind of, lost a little bit of balance, and I didn't really understand what was happening as gravity was disappearing. And these are exactly the fields I was interested in, which is applied physiology and applied pharmacology. And I said, well, let me go check this out and dip my toe in. And very quickly after dipping my toe in, I was like, I'm good. Let's get the boat and get out there and swim in this and sail around. So never looked back since then. Look, they're very grateful to those folks who delicately, talked me out of it. They were just being sincere in the sense of, this is a very unique and challenging pathway to become a physician. Are you sure you want to do this? And it was a gut check, really. So I took their advice. And so today, my daily practice would be, going into the operating room in the morning, kind of knowing what the cases I'm going to be doing that day, whether they be, otherwise healthy outpatient procedures for someone who needs to get something take care of them. For example, it might be a podiatry case where they have a toe that's misaligned and it's very uncomfortable, all the way to a trauma from a motor vehicle accident on the freeway, and every little thing in between. And so we take care of a myriad of surgical cases across all surgical patient populations, whether that be in a level 1 trauma hospital or in a local community surgery center.
Okay, so that was my next question: is are anesthesiologist assistants limited to just working in hospital facilities, or can you find them in other, healthcare locations?
Throughout, wherever the anesthesia services will be needed is where you'll find a care team model where anesthesiologist assistants will be part of that care team. So for my own career, right, when I started off, I practiced to a large extent in cardiac and trauma. It was an interest of mine as a young practitioner, and so I dove in really deep into understanding and enhancing my practice in that space. As my life and career have shifted and changes, and that arc has gone a different way, I have a wonderful family and wonderful children, and I've shifted towards more of the outpatient population, and this gives me an opportunity to go pick up my kids from school and spend some time with them afterwards. And so that's one of the unique aspects of this field, is that depending upon your interests and as your life shifts and challenge and waves, you can look for different opportunities.
Oh, I love it. I love that work-life balance, or what everybody strives to when we talk about work-life balance. That's absolutely outstanding. Tell us, for somebody who is maybe sitting in their junior or senior year of high school, what does the education pathway look like for them? What would be their first steps, and then how do they go about exploring where they would attend one of your programs?
Sure. I think a great way to kind of explore the profession is to connect with the local state society or academy. And just about every state has an academy or society. And it's a great way to provide some mentorship and some perspective from practitioners in the area where someone might be able to have more of a kindredship. And then as far as the requirements in the field, so it's very similar to medical school in the sense that we have to have the same requirements for medical school. So the general chemistry, OChem, physics, biochemistry, calculus, you get the idea. So these are hard, rigorous sciences. And in addition to that, the requirements for admission are either the MCAT test and or the GRE, which is used by many programs as well as a standardized test. Now, as standardized tests are being brought up a lot in just discussion and education, right now, because our board exam is a standardized exam, it's really a valuable resource to know that someone who is applying can perform well with those exams. However flawed they are, the national board is also a standardized exam, and so one needs to demonstrate the proficiency there.
Correct, correct. So then the years of education then, so somebody would flow from an undergraduate program directly into, no additional training or steps are needed in between an undergraduate degree and admission into one of the master's programs.
Correct, yes, and then they'd go into their master's program, and it's 24 to 28 months depending upon the state and the location of that curriculum. And after that, they would take their national board exam, and then get credentialing and licensing in that region, and be able to help care for members of their community.
All right, excellent. We actually have an audience question, so I'm going to sneak this one in before I ask my final question to you, Shane. Now, for those who are following along live, another just a chance for me to do a shout out. You can absolutely drop questions into the chat or the Q&A box. So we have one question from our audience. Yesterday, we learned about the careers in certified nursing anesthesiology. And so yeah. I have no doubt you get this question all the time. How are the two careers similar and different? And is that a question that you're okay answering? I guess maybe it's the first question to ask.
Absolutely. No, many partners in my practice hold one hat or the other. And happily great team members. And so in the hospitals where I've always worked, we have a sort of collaborative and interchangeable career, in the sense that I might have a certain case and a partner might come in and say, hey, it's time for you to leave to go pick up your kids, for example. And so they'll come in, we'll transition, and they'll manage and take over the care of the patient, and then I'll go ahead and depart. And sometimes it's the reverse that takes place. I think there's a couple of great examples, and that would be sort of the nurse practitioner and PA, in the sense that they're different pathways, but they're very often where they cross in many, many areas, right, where they have a lot of shared space. And I think the other example is the DOMD, where there are lots of similar shared spaces. And look, the more we have a diverse group of healthcare professionals, the better it is for our community, the better it is for our society and our system as a whole, honestly.
Absolutely. I 100% agree with you on that. Excellent, excellent examples of where practitioners have similar or just different training, but then similar patients that they treat, and similar philosophies in how they approach their patient care. So thank you. Okay, so last chance, if you are joining us live, drop your question in the chat. If you happen to be watching this on demand and you didn't get a chance to ask your question, you are absolutely welcome to reach out to Health Professions Week. You all know how to reach us. There's several ways that you can get in touch with us. And if I can't answer your question about anesthesiologist assistants, I will absolutely put you in touch with Shane, who I know will be able to answer your questions. So don't fear if you're watching this in the on-demand model, because we absolutely can still be here to help guide you through this. Shane, you talked a little bit about reaching out to state societies to learn more about the career, especially in their local communities. It's probably pretty hard to shadow an anesthesiologist assistant, primarily because of where you work. So how can students really learn more to discover if this is a great career path for them?
So I think one of the ways to do that is just start a conversation with the local community and understand from a discussion what that looks like. And I think that's a great way to start. And if that sort of kindles of an interest that continue to the embers grow a little bit, then you continue that conversation. And then typically for most locations, and anybody in order to shadow, there's an 18 years or older component to that. And a lot of that is because we want to make sure that we're being safe to the patients, but also to the individual shadowing. And so that'll make sure that they have all of their shots and immunizations and everything in between. And so that's an important step that takes place. So I start with that conversation as the individual gets a little bit older and they start getting into those adult years, making sure that they have those responsibilities of immunization managed, and then they can start looking at the shadowing opportunities in their community. Because of COVID, most communities have limited shadowing, but of late, we are trying to open up more, and these are becoming more and more available.
Excellent. Wonderful. Thank you so much for spending just a few minutes with us today and answering some of our questions, some of our burning questions about careers in anesthesiologist assistants. I think this is absolutely fabulous, and I hope anybody who's watching is going to take advantage of, again, learning more about the career, watching some of the videos on the playlist. Please reach out if you have any questions, and we'll see you tomorrow for our Wednesday webinars and some more career exploration. All right. Thanks, everybody. We'll talk to you soon.